is a student, thanks you. CULTIVATE is a student-run club created by the National Cellular Agri Club, which is basically funded by the USDA as a part of the 2021 USDA grants granted to Tufts, Virginia Tech, UC Davis, MIT, Virginia State, and UMass Boston. And yeah, we run these seminar series basically every single month. And so if you would like to be added to the e-list, or if you would like to stay in the loop with all things National Cellular Agri Club, or get news on when the next CULTIVATE seminar is, feel free to reach out to me or David or any of the PIs in any of the institutions. So we're going to be starting off with an opening statement from David, Dr. Kaplan. So take it away.
Okay, thanks. I don't need an opening statement. I just wanted to thank both Phil and Jeremiah for taking the time today to talk to the team and sort of convey where we are in the field related to the regulatory topics. And as agreed upon, we will record the kind of first half of the session based on your, whatever remarks and inputs you guys have, and then we'll not record the Q&A session so we can talk about whatever we want. So thank you both again for being here, and I'll turn it back to Kirsten.
Cool. So as you know, we have two very exciting speakers. The first one being Dr. Bronstein. Dr. Bronstein is the Assistant Administrator for the U.S. Department of Agriculture's Food Safety and Inspection Services Office of Field Operations. He plays a critical role in guiding the district offices, which provide inspection in more than 6,000 establishments throughout the U.S. to ensure domestic and imported meat, poultry, and egg products are safe, wholesome, and properly labeled. Prior to his current role, Dr. Bronstein held many roles within the USDA. In 2004, he started as a molecular biologist with the Agricultural Research Service. In 2010, he joined the FSIS as a microbiologist in the Office of Public Health Science. And in 2015, he was selected as a director of the Office of Public Health Science staff and provided microbiological and chemical residue support for the agency. We are very excited to have Dr. Bronstein here with us today. And our second very exciting speaker is Dr. Jeremiah Fasano. He is a senior policy advisor in the Office of Food Additive Safety's Regulatory Review Branch at the Center for Food Safety and Applied Nutrition. He has worked on a variety of issues, including pre-market safety evaluation of new food ingredients, assessment of genetically engineered new plant varieties, strategies for tracking sodium reduction in the U.S. food supply, and development of safety assessment frameworks for new food technologies and functionalities. Thank you both for joining again, and without further ado, you guys can take it away.
All right, well, thanks a lot. And I think I'm going to try to share my screen. So, host disabled participant screen sharing. Can someone turn that on for me?
Should be all set.
Okay, thank you. Okay, can you guys see the slides, or do you see the presenter mode?
We can see the slide.
Perfect. Okay, excellent. All right, so Jeremiah and I have done this a few times, so we kind of have a pretty pat story here, but it's packed full of a lot of information because most folks out there know a lot about the science, know a lot about food and food production, but don't know so much about regulatory authorities. So there will be a lot of background on these slides just to give everybody context of who exactly we are and how we do our business as federal regulatory agencies. So first I'll hand it off to Jeremiah, who will cover the U.S. Food and Drug Administration.
Thanks, Phil. Yeah, so the U.S. Food and Drug Administration is responsible for protecting public health across a wide variety of different areas, including human and veterinary drugs, biological products and medical devices, also the safety of the food supply, cosmetics, dietary supplements, products that emit radiation, as well as tobacco products. And so our overall mission is to advance public health by helping speed innovations that make medical products more effective, safer, and more affordable, and also by ensuring that innovation that occurs in development of food production is commensurate with safety and meeting the standards required by the Federal Food, Drug, and Cosmetic Act. Bill, I think the next couple slides are yours, so I'll turn it back over to you.
Thanks. And I never envy my FDA colleagues because they have a much larger mission than I do over here at the Food Safety and Inspection Service. So what do we do in the Food Safety and Inspection Service, and how is it different than FDA? So USDA, the United States Department of Agriculture Food Safety and Inspection Service, is responsible for ensuring just that the meat, poultry, and egg products are safe, wholesome, and properly labeled. This was FSIS was actually a direct result from Upton St. Clair's book, The Jungle, which described the working conditions in meat packing, slaughter and meat packing facilities in Chicago at the turn of last century. And he's famous in saying that he was aiming for America's heart and hit them squarely in the stomach. But based on that book and the public outcry from The Jungle, they actually, Congress came together and actually put together the Food Safety Inspection Service to make sure that everybody's meat, poultry supplies was safe, wholesome, and properly labeled. And so that starts back in 1906 with the Federal Meat Inspection Act. Around 46, they had the Agricultural Marketing Act. Finally, in 1957, they added the Poultry Products Inspection Act, then the Egg Products Inspection Act in 1970. And one of the things that's become very important, because we are Food Safety and Inspection Service, we also inspect to make sure that all animals are humanely treated prior to slaughter and entry into the food supply, which was back in 1958. So FSIS, as I said, you heard Jeremiah's mission, it's very big. Ours is more focused, but we do have different mandates from Congress because of those different acts. We have different mandates on how we do our inspection. FSIS, there's about 9,000 employees altogether in FSIS. That includes a wide variety of veterinarians. We're actually the largest employer of veterinarians in the country. Inspection staff, microbiologists, chemists, food technologists, policy writers, a whole bunch of different folks in that 9,000. Underneath me in the field operations, there's about 7,800 frontline workers out there, and we're in every single one of the 6,800 regulated establishments in 7 territories and 50 states in the United States. And it's about, as I said, about 6,800 establishments. Overall, we inspect, and these are staggering numbers, so please, please, the M's and the B's are correct. 162 million head of livestock, that includes cattle, pork, goats, sheep, lambs, are inspected every single year. Over 9.7 billion poultry carcasses are inspected. That's a combination of chicken and turkeys out there. We inspect over 2.8 billion pounds of liquid, frozen, and dried egg products. And my field force does about 7.6 million different food safety tasks year in and year out. So where do we actually do this, and why do we actually do it for our slaughter? And if you don't like the word slaughter, we sometimes use the word harvest. Harvest and processing establishments, we have continuous inspection. That means every single animal that is put into the food supply in the United States is been looked at by one of the inspection force in the Food Safety Inspection Service. So we're there for 100% of the time when harvesting is going on. Every single animal is checked for any sort of wholesomeness defects or food safety defects that there might be on there. And then also in further processing. So as you can see on the left, you see some hog carcasses lined up there. That's not what you see in the grocery store. You see something that looks a little bit like on the picture on the right, which is further processing establishments. So these are the ones that break down those carcasses into product cuts that you might find in the grocery stores. And in that one, we actually do, we have an inspection system that goes in there and goes into those establishments at least once per shift to make sure that they're doing what they need to do to protect public health and to make sure that product is properly labeled. In addition to that, we do 100% reinspection of all imported products that are meat, poultry, and liquid egg products. So if it comes into the country from another country, then our inspection force is there, making sure that that product meets the same standards that our domestic producers have for these products. We also have something that's pretty interesting We have pre-approval for all labels prior to commerce. This is different than the FDA, who does it a little bit differently, but we have under our mandates from Congress, we have to make sure that all labels are truthful and accurate prior to allowing that product out into the market. So if there are any sort of claims like no antibiotics ever or no GMO, well, GMO is a bad one. That one's a little bit tricky, but any sort of claims like that, organic, that they need to show us and demonstrate that those products are going to be truthful by what's on that label at that point. So how do we actually do our inspection? So we have in the processing facilities, well, in the harvesting facilities, we have inspectors on the line that look at every single one of the carcasses. In addition to that, we have inspection staff both in slaughter facilities and further processing that look through the establishment's food safety systems and how they're executing them. So these on a day-by-day basis, we verify sanitation performance standards. Such as looking at the establishment's grounds and facilities, making sure that they have potable water and they have acceptable sewage systems. That's kind of the basis for all food safety and food production. Then we actually look at their SSOPs, which is their sanitation operating procedures, and making sure that they not only have robust written procedures, but they're actually following those day in and day out prior to the production. And then finally, the keystone of pretty much all food processing and food production in the United States is a HACCP plan, which stands for Hazard Analysis and Critical Control Point Plan. So in those, you also have a hazard analysis, which says, hey, what are the hazards that are reasonably likely to occur, biological, chemical, and physical? And then also you have to have records so you have to have a HACCP plan, and then anything that is reasonably likely to occur, you need to show how you're going to control for that hazard in the final product, so the product doesn't come out of your establishment being injurious to human health. So all HACCP systems have to be validated. We look at that. That means not only on paper, do you have it written out? Is it supported by scientific fact? Do you have the scientific papers that support your mitigations for any of the hazards that may happen in your system? And then also you have a 90-day period to show that what's written on paper and what's written supported by science is actually functioning properly in your own establishment, so that you are truly mitigating any hazard that may enter into the food production stream along the way. We also have a lot of partnerships, so we do consider ourselves a public health agency first and foremost. We really are here to make sure that folks, when they enjoy meat, poultry, and egg products, they're not getting sick from any chemical or biological hazards or physical hazards for that matter. So we work with our partners in CDC, FDA, among others, to really make sure that we have a robust system to protect the nation's food supply. In addition to this, some folks really think that this is all about animals and about livestock, but we actually have a robust history of being able to inspect and make sure that a wide variety of novel technologies are being used effectively to control any sort of hazards in our food supply. And those includes, over the years, canning, different irradiation. High pressure processing is actually very something that in the last couple of decades has become very important for food production. Any sort of fermenting, including new fermentation techniques for meat and poultry products, enzyme-based processing, and also advanced meat recovery. So we have a lot of experience with novel technologies, and we have a robust process by which we look at those processes, the new processes. They can come to us, present what they want to do in those establishments. We have a robust team that comes together, multidisciplinary team that comes together, looks at those processes, and make sure that any hazards that we may think of are being controlled. And then we watch and see, gather the data and review the data from the establishments as they implement those novel technologies in the establishment to make sure they really are controlling any hazards that may be introduced, and making sure that the food supply once again is safe. So with this one, I think we'll go back and forth a little bit, but I did want to talk a little bit about the oversight of cell cultured meat and poultry. I know there's a lot of different talk around the names. But we, for our purposes at FDA and FSIS at this point, use the word cell cultured when we talk about cellular agriculture or cultivated meat and poultry, or whatever the name that you would care to provide for these sorts of products. So Jeremiah, maybe I'll send it off to you, because I think that you have the first part here at FDA.
Yeah, sure. Thanks, Phil. So most of you, since this is sort of a technical description, to be pretty familiar with most of this, but this also helpfully describes the division of oversight between FDA and USDA for cells that are cultured for use in human food from livestock or poultry. So there's an original cell sourcing step, which could be a biopsy, could come from other sources. Typically you would generate a cell bank, you would do scale up propagation, including potentially proliferation phase and differentiation phase. Again, all stuff that likely most of you are very familiar with. The next step, and this is kind of a key one, and Phil sort of touched on this earlier, is what we call the harvest step, where you're collecting cellular material from the bioreactor and preparing it for conventional food processing. And this is important in part because for cells of this type, this is where the handoff occurs between FDA and FSIS. And so you can see that there's sort of this overlapping bit here. Essentially, at the point that harvest begins, FSIS jurisdiction begins, FDA sort of maintains some attention because we're interested in the characterization of the products coming out of that harvesting step. But for practical purposes, this is where FSIS jurisdiction starts. And Phil, pass it back over to you to describe those subsequent steps.
Yeah, sure. So anything that's any of the subsequent steps that which at harvest. So we're looking at the conditions in the establishment at harvest, making sure that they're suitable in the SPS, SSOPs, and all of their hazard analysis. And as they are incorporated either in that establishment or any other establishments, there's a chain all the way through FSIS regulated establishments until the consumer receives that product. And FSIS will be there looking at those products as long as they fall under our jurisdiction. So that will be the actual facility itself with its harvest. But many of these products, folks are wanting to kind of combine them with plant-based matrices, form them into a certain sort of process, maybe put them into a burrito or something like that. Then we will be there along the way, looking at those establishments to making sure that they're still executing their HACCP plans. All the way through packaging and labeling. Sorry, I forgot about packaging and labeling. So they will need to be appropriately labeled so that it's obvious to the consumer. It can't be false and misleading. Any of the products. We don't want anyone fooled thinking that they are eating a actual beef steak or chicken, but they need to be clearly labeled that they are part of a process, that they were cell cultivated, or wherever the nomenclature lies in the future. Back over to you, Jeremiah.
Thanks, Phil. So I think the next couple slides are just to lay out a little bit more detail some of FDA's tools that they use for food safety. So as Phil had mentioned, and you can see from that introductory slide, FDA's key source of authority, the Federal Food, Drug, and Cosmetic Act, is very broad. There's a lot of stuff in there, but for practical purposes today, the thing we're going to be talking about is food and food ingredients, ensuring they're safe, wholesome, sanitary, properly labeled. One important thing here that I'll probably come back to once or twice is this: what does safe and adulterated actually mean? These are key concepts for us in statute, tools we use for ensuring food safety. Safety is a standard that typically, especially for things that are deliberately added to food, is a reasonable certainty no harm standard. It's not a sort of an absolute proof standard or a zero probability standard. It's a reasonable certainty in the minds of competent scientists who are trained to assess those kind of questions. Adulteration, this is another important concept because something that is unsafe or something that is contaminated or something that's prepared under, in sanitary conditions, those are all things that can adulterate the food. And when that happens, offering the food for sale is illegal, essentially. And so this is a key tool for us. There are many different ways that food can become adulterated. And when it is, that is something that you cannot offer for sale in the US. And so that's sort of a key concept for us. Next slide, Phil. And now I think we're going to move on to sort of a division of roles and responsibilities in a little more detail. Now, one point I want to make here about that previous diagram you saw, that actually reflects the division of responsibilities in the formal agreement between FDA and FSIS, which I think dates back to 2019. And so we laid out the different responsibilities there. And so all the stuff that we're going to discuss, most of that is in the MOU or the formal agreement. And that's something that's online. You can just Google for it and you'll pull it up and you can look at, so if you want sort of more information about this, that's all publicly available. So with that said, brief summary of the roles and responsibilities the FDA has under this agreement. We offer pre-market consultations with individual firms that are producing these kinds of products. We oversee cell collection, cell banking, and cell culture. We work with FSIS to coordinate with FSIS and oversight at harvest for livestock and poultry cells, enforce applicable FDA requirements, conduct inspections and related activities in the cell culture portions of facilities. We also, and I'll come back to this a little bit more later, oversee food products that incorporate cultured fish and seafood cells. And finally, and this is going to be a theme that both Phil and I will mention multiple times today, we share information between the two agencies. FDA and FSIS work together in a number of different areas. This is another one. And in all those areas, we work most effectively when we're coordinating and sharing information. So here again, we're doing that same kind of thing. And now I think the next couple slides are just unpacking a few of these in a little more detail. So Phil, next slide. In terms of the pre-market consultations, this is again with an individual firm. We'll be evaluating production materials, the processes and manufacturing controls, sourcing for the cells, establishment of the cell lines, the cell banks, components and inputs. Nothing particularly surprising here, right? All the kind of the core inputs that go into development of the cell culture process. And we will engage with FSIS on consultations that involve livestock or poultry cell lines and share results of those consultations for FSIS to use in their regulatory oversight downstream from that process. Next slide. Here again, the cell collection itself, the cell sourcing, this is obviously very important in terms of the identity of the product that you're ultimately making. Development of cell banks is a key quality checkpoint, and so that's something we're very interested in. And then the proliferation and differentiation of the cells. We will issue regulations or guidance as appropriate. I should mention that we already have publicly announced that we're going to be releasing draft guidance on the consultation process, although I don't have a timeline for that. And for all of these processes, FDA will be conducting inspections as appropriate. Next slide. This, again, you hear this multiple times. At harvest, FDA and FSIS will work together to transfer oversight to FSIS and provide any information FSIS needs to make decisions on the regulatory responsibilities. Slide. Applicable FDA requirements. There are a number of them here, including registration of cell culture facilities, CGMP, various other kinds of regulations related to HACCP or HARP-C plans, and also requirements applicable to substances to become a component of food. In plain English, this means food ingredients, food additives, substances that are intentionally being added in some way to food during production. And as needed over time, if we see the need for additional requirements for cell banks or cell culture facilities, then we will develop the guidance or regulation as well. I think this is the last slide, Phil. The next one. Oh, no. Okay, two more. So again, I mentioned this before, but these cell culture facilities are regulated by FDA, and FDA inspectors will be on site as needed to gather information, and will take enforcement action if necessary to ensure that everything coming out is in compliance with FDA laws and regulations. Slide. Their information with FSIS. Again, anything that we see in the culture portion of the facility we think might be an issue, we'll share that with FSIS. If we see something during the consultation process, we'll share that with FSIS. Again, this is routine across many areas, but it's another example of it here. But yeah. Okay, and then this is the final point. Sort of mirroring the division of oversight for conventionally produced animal tissue products. FDA, except for catfish, oversees fish and seafood products. And so here, any fish or seafood cells that are being cultured for human food consumption will be overseen in the same way. You have to register the facility. Various kinds of requirements applicable to those facilities will apply here. You need to make sure anything you're adding is lawful. We'll be conducting inspections. But unlike for cultured livestock and poultry cells, we will be continuing to oversee production all the way through packaging, processing, and labeling. And so labeling for these products is something where FDA will be ensuring it's truthful and not misleading, and we'll be working closely with FSIS to ensure that we have a coordinated approach on labeling policy. I think there's a diagram after this. So yes, okay. So this just reiterates this similar kind of diagram, except here we're talking about cultured fish or seafood, and FDA oversight applies all the way through. Again, except the important exception of Siluriformes fish species, the most well-known one is catfish. think it's over to you now, Phil.
All right, sounds good. All right, so after FDA has done their magic over the production and the collection, cultivation, production of those things, that's really where we come into FSIS, so at that harvest stage. So under our statutes, all meat and poultry products must be safe, wholesome, and accurately labeled, as I said before. In these facilities, we are acting like they are more like further processing facilities. So inspection is going to occur once per shift per day that they're operating. So we'll be there checking up on the facilities. We can do pre-ops or pre-operational sanitation checks. We'll look at HACCP records, any sort of other record keeping that they would have, and then as well as going around and looking at the general condition of the establishment prior and during production of any of those products. As I said before, all labels have to be pre-approved by FSIS, and in addition to that, FSIS also does equivalence with countries that are seeking to export meat and poultry products to the United States. And so you have to already have an equivalence status with US before we'll allow cell culture products from your country to come into the United States. Right now, we have no countries that can export meat and poultry cell culture products to the United States. And then, as I said before, all the imported meat and poultry products are re-inspected at our port of entry. So how do we actually do our business? So we actually do our business by grant of inspection. So FSIS has a relationship with every establishment that's federally regulated, and that process is called getting a grant of inspection, and that's how we do our business. Since we need to be there on a routine basis, daily, at least daily in further processing, continuously during harvesting or slaughter of animals, we provide inspection based on this grant of inspection. So how legally if we have problems with an establishment and an establishment is not able to comply with our food safety regulations, then we'll draw inspection. So that's directly linked to the grant of inspection. So it's really the cornerstone of our enforcement inspection and enforcement system here. As I said before, to get a grant of inspection, what has to happen before you can get a grant of inspection, before you can produce any product for commerce, what you actually have to do is come to the FSIS, show that you have a HACCP plan that is robust and considers all hazards reasonably likely to occur in your process, and then mitigations in the form of critical control points for any of those hazards. You have to have a robust sanitation standard operating procedure, and then also your facility. We walk through your facility, make sure that the walls, floors, and ceilings are cleanable, impervious to moisture, have no insects and vermin, and also meet all the other sanitary requirements that are laid out in our regulations. For these products in particular, the cell culture products, we have an incumbent upon any of the establishments at this point that want to make cell culture that they must go through the FDA pre-market consultation process. It's the only way we know that the way that they want to produce these products are safe and available and safe and suitable to be used as human food. So they must pass through the FDA pre-market consultation before FSIS will provide a grant of inspection to any facility. So our coordinating our oversight, transfer to harvest. So at each establishment that harvests cellular material derived from livestock and poultry cells for human food, FSIS coordinates that transfer of regulatory oversight from FDA. And then we'll also review information provided by FDA and the establishment necessary for FSIS to determine whether those cells are eligible to be processed into meat and poultry products. So what that really means is that if there are any problems upstream, if there are any of their indicators upstream were out of normal, then we're going to be looking at that information prior to allowing them to be harvested in our facilities in conjunction with FDA. If FDA has information or if FSIS have information, we will talk to the establishment and not allow for harvest at that time. We also require for each establishment that harvests and or processes cells cultured from livestock and poultry for the purpose of human foods to obtain a grant of inspection, obviously. And we conduct inspection at these establishments at least once per operating shift to verify compliance with our regulations.
And then, as I said before, that all food products made from cultured cells of these products must pass inspection to carry the USDA market inspection. And you cannot legally enter commerce without the USDA mark of inspection on meat, poultry, and liquid egg products. So FSIS is going to pre-approve all labeling for these sorts of products, including any labeling claims. Our inspectors verify that the label is accurate during our inspection. It's one of the tasks that they perform on a regular basis. And as Jeremiah said, we're both working together to develop joint principles for labeling cell cultured food products into their respective jurisdiction. And right now we're in the process of writing special labeling requirements, our regulations for cell cultured meat and poultry, which will enable consumers to differentiate such products from a slaughtered, other traditionally slaughtered meat and poultry products. This is a long process. If you know anything about government, rulemaking is a long and arduous process. We already had a request for information and advanced notice of proposed rulemaking. Next, we will develop. We got some notice and comment on that. We've drafted a proposed rule based on those comments, which is going through clearance right now. That will go out and will be open for comment from the general public. We'll take those comments and then a final rule. We'll publish a final rule after we've done all of that. I expect this process will take numbers of months, probably somewhere around a year or two from start to finish at this point. And during that time, we do have principles that we've talked about with FDA to allow temporary label approvals while we're undergoing the rulemaking process. So that doesn't mean that no products can come to market for a year or two. It just means that we'll have temporary. Everybody's with the understanding that if our final labeling rule says something differently, they might have to change their labels so that they'll be compliant with them. In addition to that, we do have international equivalents and imports. So basically, in general, countries must be determined by FSIS to be equivalent for cell cultured meat and poultry in order to be eligible to export that to the United States. Basically, what that really means is that we want to make sure that if a product is produced in another country, the American consumer is offered the same consideration toward public health and safety that we would for FSIS. Doesn't need to be exactly the same system, but we need to demonstrate that it has equivalent level of protection for the United States consumer out there. So we're still looking at exactly how the policies that are going to be governing this equivalence process, how we're actually going to implement those. And it's kind of hard because we kind of need to have domestic production here before we can do international equivalence. So we're working through these and we're kind of building the airplane as it's flying, as they say, to try to work out all the kinks in the regulatory structures. And as I said before, the third part of our inspection process, our importation process, is that we do reinspect all products at our port of entry. And much like Jeremiah says, we have a rich history of working in dual jurisdiction establishments between FDA and FSIS. For instance, things you may not think of, but if an establishment makes pizzas and makes a veggie pizza on Monday, Tuesday, Wednesday, that's an FDA regulated establishment during that time. But if on Thursday and Friday they want to add pepperoni to that pizza, then it becomes an FSIS regulated establishment. It's just one example of dual jurisdiction establishments that FDA and FSIS have. And we have a really great history at the local level and at the national level of correlating with FDA and sharing information back and forth to make sure that we're all know when we find a particular problem in an establishment that what we found and what we're planning on doing about it, so that if there is any affected product from the other agency, and we'll be sure to be able to share that information with each other. So we're going to continue to share information with FDA, especially in these cell cultured products. And we will always notify FDA if objectionable conditions are identified, including conditions that may have resulted from the production of adulterated or misbranded product. The next slide we'll put up for a couple of seconds, which just has a couple of folks' names. Not on the phone with the two people here from FSIS are Melissa Hammer and Josh Ayers, who are in the policy department here at FSIS. And then there's a couple of email addresses for FDA if you have further information, either the animal cell culture foods at fda.hhs.gov or the animal food pre-market for pre-market consultation, I think, at that address there. Then we also have, which we didn't talk much about today, but we also have another
area in USDA called the Animal Plant Health Inspection Service, which is actually involved in, as you might expect, animal and plant health. And so those are the ones that you see at the borders. If you've ever tried to bring in some meat or some sort of food product from another country, they might have dogs there and they might be looking through your bags and then saying, hey, what is this out here? That's APHIS actually. It's the Department of Homeland Security, and it's an APHIS officer there, and they make sure that any of the products
that are coming into the country are not posing a hazard to our either domestic or wild animal populations here in the United States. So that's overall kind of a very broad kind of work through of our regulatory structure. I know it's a lot. So we'll open it up for questions. Happy to answer anything on that, or if you have more technical pieces that you'd like to talk about any one piece of our regulatory oversight for cell culture products.
And if I could just interject before we stop recording, one thing we didn't talk about today, but the reason that the Center for Veterinary Medicine is up on the screen there is if you are culturing animal cells for use to feed to animals, that's regulated by FDA Center for Veterinary Medicine. So, for example, if you were, culturing cells for a companion animal food or something like that. So that contact email is if that is kind of the concept you're looking at. The whole scenario we've been discussing today has been for use in human food. So I just wanted to add that point there, and then this probably be a good point to, switch over to the Q&A section.